Hey, this is Dr. Paul Firnhaber. It's Wednesday, and that means it's time for another 10 minutes of truth. So today, I have another article that I want to go over. It's out of the journal Chiropractic and Manual Therapies. This is a peer-reviewed journal on PubMed. It's March 6th of this year, 2024. The name of the article is Cost of Chiropractic versus Medical Management of Adults with Spine-Related Musculoskeletal Pain, a Systematic Review. And this article was from authors associated with the American Chiropractic Association, Texas Chiropractic College, Puget Sound Healthcare System, University of Pittsburgh, St. Louis University, and Southern California University of Health Sciences. And this study looked at 44 studies and looked at what are the studies, what is the research saying about comparing the costs of chiropractic care and standard medical care for back pain. That's what they looked at. They said that the article starts out by saying the year-to-year cost of spine-related pain in the United States is about $135 billion. That's a pretty good chunk of change. In the United States, healthcare costs for low back and neck pain are rising, and as of 2016 were the highest for any condition. That's an amazing statement right there. I mean, when you say any condition, I mean, that includes cancer and heart attacks and cardiovascular disease. So that's a pretty impressive figure. So since 2016, neck and back pain have cost the medical care system, the healthcare system, more money than anything else. Chiropractic care guidelines are concordant with the American College of Physicians' recommendations for initial management of low back pain using non-pharmaceutical treatment. So what they're saying is that the American College of Physicians is recommending that non-pharmaceutical care be used for the initial treatment of low back pain. It says, although most cases of spine-related musculoskeletal pain can be effectively managed with conservative, guideline-concordant, non-pharmacological, and non-invasive approaches, frequently a patient's course of care is unnecessarily escalated by the use of more invasive, hazardous, and/or costly procedures. Such costs typically include diagnostic tests, particularly advanced imaging, surgery, specialist care, and medication use. So let's look at what the findings showed in this study. 10 studies found that the doctor of chiropractic care had lower overall costs. No studies found that chiropractic care had higher overall costs. 4 studies found that chiropractic care had lower insurance and compensation payment costs. No studies found higher insurance and compensation costs. 2 studies found lower long-term health costs associated with chiropractic care. No studies found higher long-term health care costs. Factors affecting costs. 15 studies found that diagnostic imaging, particularly advanced imaging like MRI, was used less with chiropractic care. And I would say that's absolutely true. I use MRIs, but not very often. Very, very seldom do I need to send a patient out for an MRI study. 11 studies found fewer opioid prescriptions were dispensed or filled with chiropractic care. And obviously, we don't fill those prescriptions, so they had less opioid prescriptions because they had less pain. 8 studies found fewer surgeries with chiropractic care. 7 studies found fewer hospitalizations with chiropractic care. 6 studies analyzed cost factors relating to have a chiropractor as a first care provider, and generally, this was associated with lower downstream costs. 5 studies found decreased use of injection procedures with chiropractic care. 5 studies found fewer referrals for specialist visits with chiropractic care. 2 studies found that fewer emergency department visits were associated with chiropractic care. The 10 studies published since the U.S. government declared the opioid epidemic in 2017 found reduced dispensing of opioid prescriptions when chiropractors were the first provider. Diagnostic imaging, opioid utilization, surgery, hospitalizations, injection procedures, specialist visits, and emergency department visits were all reduced where chiropractors were involved early in the case. Based on the substantial body of evidence published since 1991, a trend is developing in healthcare to include chiropractors when there's neuromusculoskeletal pain. They're an important part of the healthcare team. This is exemplified by the VA chiropractic clinics across the country. So the last thing I want to say is this. Patients with spine-related musculoskeletal pain who consulted a chiropractor as their initial provider incurred substantially decreased downstream healthcare service and associated costs, resulting in lower overall healthcare costs compared with medical management. So again, this study shows that chiropractic care is less costly and more effective than your radical and more invasive medical procedures. So I would encourage you, if most of you know people who have musculoskeletal pain, the research is in. The studies have been done. It shows factually and conclusively that chiropractic is less expensive and more effective than medical care for neuromusculoskeletal dysfunction. And I would recommend that you tell your friends this, that you share this video with them, friends and relatives, because this is important information that a lot of people in our culture aren't aware of and they need to be aware of. So go ahead and share it with them. If you have any questions about the study, you can always contact my office. This is Dr. Paul Firnhaber, and we're at 4535 Normal Boulevard, Suite 105, here in Lincoln, Nebraska. Our phone number is 402-488-2220. If you'd like to come in, you're not a patient, you'd like to come in and just get checked to see if chiropractic care could help you, we do that at our expense. So hope you enjoyed this 10 Minutes of Truth. I will be gone next week. I'll be on vacation, but I'll be here the week after that, and we'll have another interesting article to talk about. We'll see you then.